we're talking about a lot of things about your health because we want you to be around for a long time. I want to be with you for a very long time. And we talk about the vaccinations, and there are a lot. I'll ask Dr. James Rowley about this in a second, but for example, my good friend Jim Ives from Rose Pest Solutions sends a note saying, Paul, one issue is, in fact, frontline medical workers that don't want the shot. Last I heard, there was an over 30% refusal rate in that category. He also said he has a friend who's a doctor who's saying not to get it. And it wasn't a particular individual health issue that was the reason for him saying that. Seems like we're swimming upstream. Thank you, Jim Ives, for that. And Dr. James Rowley, welcome to the Paul W. Smith Show, Medical Director of the Sleep Disorder Center at DMC Detroit Receiving Hospital. This isn't what you're scheduled to talk about, but do you believe in the vaccine?
Well, good morning, and thank you for having me. And definitely, I believe in the vaccine. I got it the first day it was offered here at the Detroit Medical Center and had no hesitation at all for getting it. Every patient I see in my outpatient setting, because I am a pulmonologist as well, I have been encouraging it, and I've been so happy when people tell me they've already gotten it.
Excellent. There we go. I didn't think I'd have to ask another doctor, but I have to ask. But be that as it may, I believe in it too.
That's okay.
I got my 2 shots. My wife Kim gets her second shot today. As many of the family members as possible have been getting it. Now we have to turn to the kids, and that's another story for another time. But the big issue here is, I think I'm not alone in saying that I don't get enough sleep. I think America is sleep deprived for whatever reason. And it's now, unfortunately, we see by middle age, with a study that is not some little study, it's a 25-year study, we are going to pay the piper big time, or at least there's a risk of dementia that is to the level of 30% if we're sleeping fewer than 6 hours a night. And I hate to say it, but I am sleeping far less than 6 hours a night, Doctor. What do we do here?
I believe that what we need to do is we just need to get back to fundamentals, which is we need to be getting 7 hours of sleep at nighttime. That is the recommendation from the American Academy of Sleep Medicine. You are correct that way too many people are not doing it. I think the 24-hour nature of our society now is not helping. I mean, this has been a problem for years, but I truly believe, as I see more and more patients who tell me their cell phone is in their bed with them, not on a nightstand, who take their laptops to bed. There are still people who keep their TVs on all night. So I believe that we really need to just realize that there needs to be a good 7-hour period of the day that you have the electronics turned off, your lights are turned off, and you're trying your best to get some sleep.
You know, it occurs to me, a lot of and this hurts me in my business, a lot of people don't wake up with a clock radio anymore. They wake up with their phone.
That would be correct.
That phone is right next to the bed, which is said to be not a very healthy place for the phone to be in the first place. But my phone is right next to my bed. And I mean, it's like, do as I say, not as I do. But the fact is, this is something that is so basic to our good health and a long, healthy, good life. And the bottom line is, it is completely within our control. It's really about, I don't know, it's about re-educating ourselves or reconvincing ourselves or realizing that everything we come up with as an excuse for why we're not getting enough sleep truly is within our control. So I think what it is we need, Dr. James Rowley, is massive behavioral modification.
I would totally agree with that. And we definitely, at the Academy, I'm actually very active in the American Academy of Sleep Medicine, and that is one of our focuses right now is sleep is essential to good health. We are working on some public campaigns to get the word out, and I try every time I see a patient, I try to remind them that they need to go to bed at a decent hour, get some sleep. And a lot of them who do it come back and they're like, yeah, oh man, I feel so much better now because I followed the advice and I'm getting, good 6 to 7 hours of sleep at nighttime. And you are correct, though. It is very much a matter of will. It's interesting. I've actually been getting maybe a little bit more sleep during the pandemic because I realized I needed to be up and awake during the day to take care of these patients. And so I've been trying very hard to get 7 hours of sleep in the last year. And I do feel a little bit better overall. I mean, I used to be more like a 6.5 hour person, and I can definitely tell the difference sleeping longer.
Let me use myself as an example. Say 9 o'clock or so, I feel so tired that I could go to bed, but I will not allow myself to go to bed. I still believe I have work to do. I've got to do this work for the show tomorrow. So 9 o'clock, I feel like I could go and fall asleep immediately. I get my second wind. And the second wind, I'm wide awake, and it takes me to 11, midnight, 1 o'clock in the morning, and there I am again with maybe 4 hours, which is actually pretty good for me, but of course it's really bad for me. But what happens? What do we do do we go to bed at 9 when we feel really tired? What do we do with that second wind?
So may I ask what time your show starts? Is it 6 o'clock?
Well, lately it's 6 o'clock. It had been 5:30 in the morning.
5:30. Okay. Yeah, I would tell you, yes, you need to let yourself give in and go to bed at 9 o'clock at night. I know that's probably a difficult thing to hear, but
it is.
That is what happens. That is what happens. Is that you sort of fight past it a little bit, and then you're going to feel, oh, I can keep doing this. But over time, it's just going to catch up with you. While the study you mentioned talks about health, mental health with dementia, there's a lot of studies out there about cardiovascular health, diabetes, overall mental health, immunologic health. Vaccines don't work quite as well in people who don't get as good sleep. So since we talked about vaccines earlier, it just really is important for you to say, no, I need to go to bed at 9. And I must admit, I've heard like anchors on, morning shows, I've heard them say, yeah, I go to bed at 8 o'clock at night. And you feel sort of like, oh, that's so early. So many things are still happening during the day. You want to stay up. But I think they're doing the right thing by getting to bed that early, so that when they get up at 3, 4 o'clock in the morning, they're ready to go. Be bright and cheery on TV, radio, whatever.
I feel, if I go to bed that early, I feel like I'm missing out on life. On the other hand, I'm killing myself, not letting my brain regenerate, get rid of the toxins and all the other stuff. Here's yet another study that shows you have to have at least 7 hours of sleep or you're hurting yourself. And we go back to the best evidence to live a good, healthy life: not smoking, only drinking in moderation, staying mentally and physically active, eating a balanced diet, get those fruits and vegetables in there and more of them, keeping your cholesterol and blood pressure levels in check, and you're going to keep your brain as healthy as possible. Less food, but more exercise, more clean water, more sleep. We can do all of that.
We certainly can. It's just a matter of turning off the light and turning off your electronics.
And turning off my brain.
Exactly.
In which some people say that shouldn't be difficult for me anyway with such a small brain. Thank you, Doctor. Thank you,
You're very welcome. Thank you for having me.
All right, take care. Dr. James Rowley, Medical Director of the Sleep Disorders Center at DMC Detroit Receiving Hospital. I don't know how many times we need to hear it, but we're going to hear it as much as we have to till we all start to do it, okay?